mode.
Good morning, everybody. This is Eliz Roser from the Pathways RTC. Thank you for joining us. We apologize. We were having some technical difficulties this morning. Just a few reminders before we get started on how to use GoToWebinar. We recommend that you move any electronic handheld devices like your cell phone away from your computer and speakers. We also recommend if you have any file sharing applications open that you go ahead and close those now. Check your settings in the audio panel if you're experiencing audio problems. During the presentation, we will have some time for questions and answers at the end of the presentation, and you can type those into the chat box, but those will be held until the end of our presentation. And all audience members will be muted during our call. And if you would like to have this copy of this presentation, it will be available on our website right there. I'd like to hand it off to Pauline Javanji.
Hello, my name is Pauline Javanji and I'm a member of the Pathways Transition Training Collaborative, which is one of the projects of the Pathways Research and Training Center based in Portland, Oregon at Portland State University. And this morning we're going to have our webinar focused on addressing the core knowledge, skills and attitudes that service providers need to effectively serve youth and young adults with serious mental health conditions. Our panelists this morning are a young adult, a family member, and several service providers and advocates who are going to share their experiences as we discuss how to best develop and implement transition-focused interventions and policies. And I'm going to introduce our presenters this morning. My name is there first on the slide. And then this morning also with us is Eliz Roser, who works with me here at the Pathways Research and Training Center at Portland State University. Martin Rafferty, who is the Director of Youth Move, Oregon. Joan Disler, who works at Rising in Minnesota, where her focus is on employment opportunities for people with disabilities. Don Schweitzer, who is at Pacific University School of Social Work in Oregon. Marlene Penn, who is a family technical assistance consultant in New Jersey. Laverne Miller, who works for Policy Research Associates Incorporated in New York. And Eileen Brennan, who is my colleague here at the Pathways Research and Training Center. The Pathways Research and Training Center developed a community of practice which we've titled the Pathways Transition Training Collaborative, and to work on developing training to improve services for young people with serious mental health conditions. Communities of practice are groups of people who care deeply about a common concern and communicate regularly to expand the knowledge of the members and improve practice, and to develop training materials and opportunities to improve services for young people with disabilities. The PTTC, as we abbreviate it, has been building curriculum offerings with its community of practice beginning in fall of 2009. We're led by social work faculty and include in the collaborative members of youth and family organizations, service providers from a variety of settings, including mental health, vocational rehabilitation, juvenile justice, child welfare, and special education, and also researchers and educators from a range of disciplines, including developmental psychology, education, rehabilitation counseling, psychiatry, public health, and social work. We engaged in a process of developing interdisciplinary direct service competencies. First of all, our group members approved a definition of competencies which includes knowledge, skills, attitudes, and values. And I believe that you've all received or have access to a copy of the competency document that we have developed that includes that definition. Then we looked at lots of other model sets of competencies and the literature on transition services for young people with mental health disorders, transitions related to other disabilities, and based on a very large exploration of literature and conversations with lots of people, we developed a preliminary list of core competencies which we then shared with the Transition Training Collaborative members and other stakeholders who reviewed the competencies and amended the list, which is now serving as a guide for curriculum development. So we have 10 competencies that we're going to be discussing this morning, and Eliz is going to introduce each competency, and then we have panelists who will talk about examples of each of those competencies.
Great, thank you. So our first competency is partnering with youth and young adults. The definition is engages with youth and young adults as full collaborators in service planning, delivery, and evaluation. And is Martin Rafferty available? Okay, so we were having some technical problems this morning, so Don Schweitzer will be filling in with an example.
Well, good morning, everyone. Again, my name is Don Schweitzer. I'm an assistant professor at Pacific University in Oregon in the social work program. My history includes working with runaway and homeless youth as a program director of a basic center and transitional living program. Between that role and the one I'm currently in, my research is focused on the runaway and homeless youth population and specifically involving runaway and homeless youth with program evaluation. And so when we think about engaging youth and young adults as full collaborators, something that's been very useful to me to reference is, and you may be aware of this, but it's Hart's ladder of youth participation. And pretty much if you Google that anywhere, it should pop up, and it kind of shows these 8 different rungs of that help me kind of reflect on at what level and what depth am I truly engaging young people as full collaborators in this process. And the bottom rung, young people are manipulated. The second one, young people are decoration. All the way up to 7, where young people lead and initiate action, and the top rung, young people and adults share in the decision-making process. And so I do think it's important for us as providers to really reflect on what level we are including youth currently, and start to look at ways that we can increase, improve, kind of up that ladder of participation. One example that I have is my dissertation work, where I hired runaway and homeless youth who were currently in a program or had recently left a program to analyze data around program evaluation. What were programs doing right? What were programs doing well? What are some key characteristics of programs, of staff, of the ways that these interactions take place that that other programs could perhaps use as model, or at least ensure that they are meeting these specific items at evaluating how they're doing on these items. And I think it's what I was most excited about the work is that, well, number one, the youth were well up to the challenge of taking on massive amounts of data to sort through and decode, and number two, the findings that are coming out of that work, I'm confident are things now that are really important to the youth that are in these programs and utilizing these services. And so I see that as just a win-win situation all the way around. It's good for the youth because it develops their leadership abilities. It allows them to see what they're capable of doing, and for program evaluation, it really starts to distill down through this what can sometimes be white noise of data to some key things that are really important to those that are utilizing our services.
Great, thank you, Don. Our next competency, number 2, is supporting recovery and empowerment. Participates in advocacy by providing accurate information about youth and young adults with mental illness, identifying and challenging situations that are stigmatizing, advocating for policies and procedures that respect individual rights and dignity, and working with youth and young adults to challenge oppressive power structures and overcome legal barriers. And I understand that Martin is available. Martin, are you there?
Yeah, can you guys hear me all right?
We can hear you, thank you.
Great. Sorry about the technical difficulties earlier. So I just wanted to give a few examples, and one of them is one that if you follow the RTC very well, you'll know that the Mental Health Youth Bill of Rights was a document formed in 2009 at the Building Family Strength Conference in Portland. And this document was a document that was put together by young adults and young people to really talk back to systems about their mental health care and about what the rights that they felt like they were entitled to. So this document was signed by the governor of Oregon in 2010 on Children's Mental Health Day, and it's a document that is being adopted by Youth Move National. The document can be found at youthmoveoregon.org, and it talks about some core rights, such as being able to have a smooth transition between mental health services from one counselor to another, being able to be informed about medication choices and what the effects are going to be. So when young people were asked the simple question of what rights do you feel like you're entitled to, they came back with this really brilliant document that has really standed the test of the professional system as well as peers across the country. We also have a program running down here in Wayne County in Oregon that really is working on putting professionals behind young people in a transitional aged youth pilot program that we're running. And this program is actually putting 2 full-time professionals behind peer support specialists who kind of help young people navigate the system. An example of this is the food stamps that you can go and get in Eugene for young adults who are struggling economically. There are 6 or 7 different documents that they had to bring to be able to get the service. And so these professional navigators worked with the peer support specialists to come up with a better system on how young people could access the service easier. So it's really about combining professionals, the kind of professional mentality alongside with the young people, listening to what the young people want and then translating it back into the professional realm.
Great. Thank you so much, Martin. We really appreciate your example. Moving on to the next one, number 3, planning partnerships with providers of other services. Forms partnerships with family members and service providers in relevant agencies and systems to develop and implement individualized transition plans for young people. And we have Don Schweitzer with Pacific University in Oregon with an example.
Yeah, and I guess I want to kind of preface that example with, planning partnerships with other service providers. And I think we all know this now. It's much more than just creating a list of referrals that we send young people and or their families out to, try to navigate the system with. Oftentimes, I think we forget how good we are at our jobs and how well we understand the systems and the documents and the in this step before this step, but for someone who does not work in that field on a daily basis, these things don't make logical sense. And so what we might consider very simple tasks, there's lots of barriers out there that we may not realize anymore. And I like to use the metaphor of the Sherpa, which aside from being an ethnic group is also the title given to the guides that take people up to the top of Mount Everest. They have the expertise, they have the experience, they know the way, yet the people that are going with them have to do their, they've done their part too. They've trained, they've worked hard to be ready at this point to make that climb. And also, as the Sherpa knows, their job is to get the client safely to the top, knowing all the while that once they get there, the client, in quotes, is going to get all the glory, and the Sherpa's going to get none. So, we have strengths and skills, but we also have to recognize that young people have strengths and skills, and we need to partner with one another if we hope to achieve successful outcomes. And so youth transitioning out of foster care who want to attend college, we're pretty well aware, often met with lots of barriers around with people that don't really understand their certain circumstances. They're used to the normal student that comes through, and our youth don't meet that criteria, and so financial aid officers are often unfamiliar with things like Chafee education grants or other benefits that youth may be eligible for. And for an example, a caseworker at a local ILP program sets up a meeting with a local community college financial aid officer and explains these special needs and entitlements that a foster youth may need or may qualify for. And so they create an agreement is made that when the youth states that they want to go to that college, they are sent directly to that financial aid officer. So we don't ask the system to create the training. We create the partnerships that then facilitate the training to make sure that our youth are getting what they need.
Great. Thank you, Don. Our next competency, number 4, providing individualized, developmentally appropriate services. Assists and facilitates the development and implementation of an effective service plan that reflects the preferences, needs, interests, and desired outcomes of the young person participating in the planning and services. And we have Don again.
So individualized service plans are not new to anyone. I mean, we've known that if we want buy-in from the youth we work with and their families, we have to generate a plan that is very specific to this individual that we're working with. And it also needs to be developmentally appropriate, and I think too often we get hung up with chronological age versus developmental age, and so those things come into play. What I might ask an 18-year-old to do is probably going to be different than a 16-year-old, but they could very well be flip-flopped based on developmentally where they're at and what they've tried before and who they are. And so it does become challenging, especially when their goals don't align with our realism or our pragmatism. And the example I always think of is the youth that you're working with wants to go to college, yet they struggle to get through high school. And so how do you align those two kind of different views of what's possible out there? And I think part of what comes into play on this, especially I remember myself wanting to kind of protect youth from the pain of failure, yet at the same time realizing that it's through those failures that I have probably grown and learned more than I ever did with successes. And so it's about helping, becoming comfortable with failure within a supportive environment. And I think that's the missing piece that we so often see out there as youth are experiencing failure outside of a supportive environment. And so that's when failure can be really detrimental. But inside a supportive environment, failure can be an incredible learning tool and something that I think as youth workers we need to become more comfortable with. And one strategy for kind of this example I gave is breaking down these larger goals of going to college into smaller ones that each one of those become individual successes regardless of whether or not they ever get to college. For example, and this is one I got from a local service provider, developmentally disabled youth wants to go to veterinarian school but can't pass Math 20. She's currently in that class for the 5th time trying to pass that class, which in and of itself is an incredible strength. But concurrent to that, staff have set her up with an internship at a local dog groomer's, providing her the opportunity to build the skill set specific to her goals, working with animals while she's working on these other goals. And so I do think we have to be cautious about, being that kind of wet blanket. If on youth goals, because the fact of the matter is, what if they can succeed at these things? We don't want to be the barrier to them succeeding in their goals.
Great. Thank you so much, Don. Those are great examples. Moving along to number 5, addressing transition domain-specific needs. Collaborates with young people to meet their needs for education, employment, peer support, parenting support, safe and stable housing, income maintenance, participation in community life, and adult well-being in the context of relevant policies and programs. And we have Joan Dissler from Minnesota to share some examples with us.
Hello, good morning or good afternoon. Joan Dissler with RISE. I work as a director within our agency. I hear a lot of echo. Is it echoey on your end, or?
Nope, I think you're fine.
Okay. Some examples I have, and again, I think the biggest important thing is to make sure that our staff know the services available. One example of something we've done with the young adults in our program is we had several students wanting to do CNA, home health aid, PCA type work, and all the students that went to the local college could not make it through what's called the Acuplacer. So we actually worked with the college and talked with them about the course and realized that the Acuplacer is at a 8th grade reading level, and for it to be a CNA, for the testing and to do the position, you need a 4th or 5th grade reading level. So we worked with the college to customize the training program for them. We actually had a selected instructor and had them working with the students to actually make it through the class. And we set up tutors and a direct staff to work there in the classroom environment. Another example would be regarding employment. Our students that want to go back to work right away will go to rehab services or local rehab and realize that there's a orientation, a long waiting list. So we work with local rehab to actually meet directly with the students first and having them go through the long process of orientation and meetings upon meetings to make them eligible. So actually local rehab comes right to our location to open cases for students. One more quick example in regards to financial and benefits information. We have a program called DB 101, which is in Minnesota, but I know some other states have that as well. That is California, Michigan, and New Jersey as well. So our staff utilize that computer program quite a bit. And that is at www.db101.org.
Great. Thank you so much, Joan. Our next competency is using evidence-supported practice and individualizing interventions. Locates, appraises, adapts, and applies established and evolving knowledge about mental health and a range of effective practices and programs. And Joan has another example for us.
Sure. Following the evidence-based practice support and employment model, we have several students that we realized were utilizing the same mental health center for services for therapy and psychiatry. So we actually developed a team of service providers within that mental health center, which includes an employment staff, therapists, psychiatrists, housing staff from our agency, as well as other service providers on the team. And we meet twice a month or so and go through each student that we're all serving mutually. And that works really well because we all communicate, we're on the same page, we know what students are doing at any time, whether it's education or vocational services or mental health service. We can kind of keep up with what's happening with all the students and really give each other advice and bounce ideas off each other about services for all the kids we serve.
Great. Thank you, Joan.
You're welcome.
Our next competency, number 7, collaborating to bridge systems. Reaches within and across services and systems to build constructive working relationships focused on assisting young people to achieve their goals when confronted with fragmented systems. And we have Marlene Penn with an example.
Thank you. I come speaking today as a family member, as a parent who has navigated through multiple child-serving systems. So as family members and for youth, we personify multi-system involvement. Like it or not, we really interact daily with multiple systems: school, mental health, child welfare, maybe juvenile justice, the courts. We navigate daily throughout all these systems, even if they're not talking to each other. I became a family partner, that's a parent advocate, a provider of support to Mary and her family here in New Jersey. And her family included a 16-year-old son, Evan. Mary was very intimidated by the service providers, child welfare in particular. When referred to our wraparound project, this is a service planning approach designed to bring representatives of all the supports in a child and family's life together. When referred to the wraparound program, Mary just simply planned to do what they said. She was very resigned to that. While we were together one day early on in this planning process, she got a call on a Friday telling her that her son was going to be discharged. Her son, Evan, was going to be discharged from the residential facility that he was in on Tuesday. There was really no transition plan other than there was going to be a meeting after he returned home. Very defeated, Mary was just resigned to do as they say, but she knew the drill. He'd come home, no real preparation, and it would fall apart, as had happened before. As her family partner, as her peer support, somebody who had been through this stuff before, I had the knowledge and I had the skills to begin to build bridges, but I wanted to begin to empower her. I wanted her to feel that she could do this herself, whether I was there or not. I urged her to call her care manager. This is the person who would organize the plan. And I was ensuring her that I was going to be right by her side when she called. But she got an answering machine. So next I coaxed her to call the supervisor. She got an answering machine again. Okay? But I felt like this was important enough to politely call the clinical coordinator of the agency to explain just how unplanned and fragmented this felt and how this had not helped build success in the past. Holding her breath, Mary called. She got results. A wraparound child-family team planning meeting was held in efforts to help Mary and her son have a successful transition home. And Mary felt very empowered to begin to build those bridges herself.
Great. Thank you so much, Marlene. Our next competency, number 8, promoting support from family, peers, and mentors, builds on the capacity of family members, peers, and mentors to provide support in ways preferred by the young person. And Marlene has another example for us.
Okay, thank you. So we talked about family partners a little bit, or the peer-to-peer support. We draw on our own experience as a tool to support families. We know that it's critical to make parenting decisions that take into account the unique personalities and needs of each of our children, of all of our children. Just as we know there's no one size that fits all in any of our own families. Those of us who are on this call, no one size fits all meets the needs of all of our children. And so certainly there's no one size fits all for young people with mental health needs, no matter what program they happen to be enrolled in. It's my experience, and the experience of some of my family colleagues, that sometimes the formal system is designed in such a way that it kind of drives a wedge between parents and our own transitional aged youth. In any family, all of our families, we hope teens and very young adults, they experience a desire to become independent from their parents. It's natural. And parents struggle with this independence. That's kind of natural. But when our children have complex mental health needs and when we're under some very other stressful pressures, this can be really difficult. When there are people watching and assessing, making notes and reports. It's very challenging and, frankly, a little scary. So Mary and her son had to begin a new relationship. We did create a plan for him to return home with, hopefully to make a successful transition home. But he had been living in the residential facility for 4 years, about 1.5 hours from home. This is not unusual. Mary didn't have the money to visit him a lot, lunches, entertainment for the day, gas tolls, so forth. How could she really know him? How could Mary really know her son who had not lived in her home for 4 years and what his preferences were? Only the facility staff really knew his preferences on a day-to-day basis. So Mary became very involved with our family support organization, our peer advocacy organization. She was learning parenting strategies from other parents who had met these challenges head-on, folks like me. She participated in the wraparound child family team meetings, and her son, Evan, got involved in the youth partnership, which was a leadership opportunity for young people who've had experience in the child serving systems. And a lot of our kids, they haven't been able to be on student council. They haven't been able to do some of these leadership activities that other young people have. So together with these teams, they found ways to live together. Frankly, there had to be compromise, just like in all of our families. Sometimes decisions were made that Marie was happier with, and sometimes Evan's point of view carried the day. Today, Mary, a former client of Child Protective Services, she's on the board of directors of our care management organization. Evan remained at home. He never bounced back into any kind of an institution. He works, and he's a father.
Great. Thank you for that story, Marlene. We really appreciate your perspective. Moving along to number 9, meeting the needs of diverse young people. Communicates effectively with and is responsible to the preferences of diverse young people and families. And we have Laverne Miller with us with an example.
Hi, good afternoon. My name is Laverne Miller, and like many of the other speakers, I bring a particular perspective and experience to what I'm going to talk to you about. I work provide technical assistance to SAMHSA-funded statewide adult consumer and family networks, as well as the work that I've experienced that I've had as a director of a community-based employment program that at particular points worked hard to engage young people as well as their parents and other family and key community members in supported employment initiatives. I'd like to say basically that thinking about communication is across several domains. It's not just what is said; it's how, what, when, where, and the like. And one of the things that I've learned in my experience, and I'll give you an anecdote a little later, is that young people, no matter what their challenge is, young people as well as their families have strengths. And many of us have got accustomed to the language of pathology and the language of hopelessness, unfortunately. And that kind of language, those kinds of things that are communicated to young people and their families at times of crises really don't resonate and really don't offer the kind of hope and resiliency that young people as well as their family members really need to hear at a point at which the young person as well as his or her family is in crises. One of the things that we found most helpful is really having youth and youth-driven organizations help guide the process. Quite sometimes it's as simple as deciding, helping young people decide what colors of paint should be on the walls or the kinds of offices or the layout, the kinds of recreational social activities that need to be incorporated into whatever direct services that you're providing. Because it's key that young people, it's been our experience that young people have thought a whole lot about what would work and really talk to each other. The role of culture is also important, and I bring this up within the context not just of youth culture, but within the context of the diverse communities that all of you work in. And what we found is most helpful is taking an asking stance. the notion that one can know everything about everyone. I think we all realize that we live in very diverse communities, and quite often the best communicators of what the values, the mores, the ways of doing things, both in terms of the young person as well as his or her family, are best communicated by really being open and asking the stakeholders of what works and why, and really working with stakeholders and champions in the community to design programming that really meets those needs and doesn't create additional barriers. I'll give you an example of something that with the project I work with. I provide technical assistance to a youth organization, a budding youth organization in the state of Washington. And they're working on, it's Youth in Action, and they're working on, quote-unquote, a bullying project. And I was struck by the lead youth by saying basically that they decide not to communicate or use language that communicated the helplessness and the victimization of bullying, that using what happens to many of our young people with challenges and with disabilities in schools and other places is not just bullying, it's peer abuse. And so it's interesting to hear from this young person how in her work with young people, the tools and other things that she's using, is that she's no longer using the term bullying to really define what it is that many young people experience, youth experience. And I think that's just one example of really, youth being able to really help guide the kinds of messages, the kind of communication, the kinds of things that we really offer other youth in transition as well as their families. And I was struck by how different bullying is from peer abuse. And when you use the term peer abuse, what that really means, both in terms of empowering the young person to act, but also in empowering communities such as schools and to take responsibility and take ownership and react as well. Thank you.
Great. Great. Thank you so much, Laverne. We really appreciate your perspective and your example. Our final competency, number 10, is evaluating and improving services. Systematically evaluates the services that he or she offers, uses feedback from young people and their family members. When relevant, participates in program evaluations and research to improve services. And we have Eileen Brennan from the Pathways RTC with an example.
Hi, this is Eileen Brennan. I'm a professor of social work and someone who's taught and loved program evaluation for many years. And I'd like to today talk a little bit about how you really involve young people and their family members in evaluation. I'd like to give you what I consider a wonderful example from an organization called Friends of the Children. It's a community-based program that pairs children identified being at risk in kindergarten with a paid professional mentor until they're 18 years of age and become young adults. This program was founded in Portland, Oregon in 1993, and it's really had great success in helping children thrive under very harsh circumstances. A substantial proportion of these children and youth have experienced either emotional or behavioral difficulties, and some actually have been diagnosed with serious mental health conditions. The outcomes for the children and youth in these programs have been very positive. There's a high proportion of them who have avoided teen pregnancy and juvenile justice involvement, and they've graduated from high school and gone on to college or other trade schools to further their education. Well, Friends actually began their program by matching 24 young children with 3 full-time paid mentors, and they were first graders. And over the years, the program grew, and so did the children. And I served as a board member and as the chair of the evaluation committee. And we realized that we needed to do something to develop the program so that it would be appropriate for young people and young people who are becoming young adults. And so what we did was go to the young people in the program and their family members and ask them about what would be appropriate for them in terms of program development. We also went to cultural leaders in the community because the community served African American, Latino, Asian American, and Russian immigrant youth. And we used that and the program evaluators use that to develop the program, but also to develop instruments and questions that we would use in the evaluation of the program. So what happened with the program was that there was a movement from one-on-one meetings and activities to group functions, to the young people becoming involved in community service, and for them to be part of leadership opportunities. And along the way, the young people developed a leadership council, and that helped to redesign and develop the program, and also got results from the program evaluation. So Friends is still evolving, and its Portland, Oregon site now has over 350 young people that are supported by 42 mentors. The program has grown to be present in 8 other cities, from San Francisco to Boston, and every year they perform program evaluations, making changes on the basis of feedback from mentors, youth, and the teachers who work in the schools with the young people in the program. And I think it's a great example of really putting the 10th competency into practice. So with that, that concludes our listing of the competencies and our giving of examples, and we're now prepared to take questions for the next few minutes. And we actually have a few questions that have been asked already. First question is, where is the information on the youth ladder of participation? And that's been sent by Jolene Haggard. And I'm wondering, Don, if you want to answer that.
Again, I think people can just Google ladder of participation. I'm doing it now, participation. So I'm seeing it, do you want me to just list it or just type in the email, the web address?
Just go ahead and spell it out for us, please.
It's www.freechild.org/ladder.htm.
Thank you, Don, for giving that location of that important information. There's a question about from Keisha Micheletti about whether there's peer support specialists anywhere besides in Eugene in the pilot program. And I'm wondering if we have Martin back to answer that.
I think Martin has left the call. I know he's traveling and is in an airport right now, so...
I think, Laverne, you had a possible answer to that?
Yeah, I do. Hi, this is Laverne, and there are two programs, great programs I know, one in Pennsylvania and the other one in Arizona, funded by Magellan, Managed Healthcare Organization. I can give you the website. It's www.Magellan, MAGELLANOFAZ.com/mylife. I would recommend, they really are, they're in the process of training youth to be peer specialists, peer navigators, as well as really doing community outreach to the larger community. And so, I think that would be a good spot to really check and see some of the innovative programming that's going on. And they've also developed a whole kind of literacy package, health, behavioral health, education literacy package for young youth in transition and young adults, which should be available over the internet into the public.
Here in Minnesota, we have on our EBPSC team. We have a peer support specialist that comes monthly to our meetings as well.
Thank you. Our next question is about that website that you cited. Joan, could you give us the correct citation for the DB101 website?
Yep. Yeah, I'll give it a try. There's a lot of echo, but it is www.db101.org. 101.org.
Okay, thank you.
Can you just repeat that just to make sure I got it right here, because it's a lot of echoing.
Yes, please.
I want to make sure that you guys got it right.
Okay, Amy Little also has given us that website. Thank you, Amy, one of the participants. That's www.d as in dog, b as in boy, 101.org. Thanks to you, Amy, and to Joan. Then the next question is from Carmen Abel, who wondered what year the Friends of the Children program started. And it actually started here in Portland, Oregon in 1993. And so we've had quite a few graduating classes, and we've been able to track their progress over time. And one of the things that's happened with Friends is the young people really want to keep in touch with us after they have graduated from the program, and they often come back and work with children who are still in the program and continue to give back in the light of community service that they learned in the program. So it's a really wonderful organization. We have another question about Multnomah County, Oregon, the system that catches students that are aging out of school at 21. Could someone speak to that, please? I think we might not have an answer for that, Keisha Micheletti.
Can you repeat the question?
Yes, it's actually a very specific question about Multnomah County, Oregon. What is the system that catches students that are aging out of school at 21 years of age that do not qualify for services through developmental disabilities because of a mental health diagnosis? And if we don't have one that can, a person that can answer that question, we'll get back to you, Keisha, and we will email you the answer. Another question is from Brianna Wales. Many organizations in Massachusetts, it's an answer actually, are also using the peer support model. So that's good to know. Thank you. Here's a question from Teresa Cummings. The Healthy Transitions program in Jackson County, Missouri has been successful in implementing family support providers and is getting a peer council started. Thanks. I guess that also is an answer. Cindy Slavens is asking Laverne to repeat her website.
Okay, just a moment. I'm on it. Look, okay. It's www.Magellan, MAGELLANOFAZ, and the project is called My Life, which is Magellan Youth Leaders Inspiring Youth Empowerment.
Okay, thank you very much.
You're welcome.
We have a question from Christina Rodriguez. Sometimes young people are hesitant to participate in mental health community-based programs because of stigma associated with mental illness. How do other programs address this issue? Would someone like to jump in with an answer?
Hi, this is Laverne, and I think I'm going to answer it from my own personal experience as a person who's experienced symptoms of bipolar, of manic depression probably in my early teens, about 12 or 13. I think that, the language of disability didn't resonate for me, and it doesn't resonate for young people. I think, the hardest thing, I can remember the vast majority of messages that I saw both in film. I can remember seeing the Snake Pit and other kinds of film, and it just made me think that, if that's what's going on with me, I'm a bad person and something is wrong with me. What I've seen work and what I've encouraged other organizations to do is to really focus on overall wellness and healthiness, and that seems to, there's less stigma attached to, a whole wellness approach. Because after you're not saying that something is wrong with someone, you're really saying to someone that you have a responsibility to really to take care of yourself and to get whatever resources in your community that may work. And so I think that's one strategy that I've seen organizations successfully employ. The other thing is really on another level is exposing young people and young adults to consumers who are in recovery. Young people really need to know that a diagnosis, as well as their families, is not a death sentence. And that's why the collaboration with consumer-operated programs and networks in your communities are really key. Because for me, as a young person, I wanted to meet someone who was doing okay, and that was doing well, and that I could only hear that message from someone who was either going through the same journey I was going through at that time, or had gone through it.
And this is, thanks Laverne, this is Eliz, and I just wanted to, I know that Martin isn't available on the call anymore, but Youth Move Oregon, as well as Youth Move National, does a lot of work again, around reducing stigma. And I also wanted to provide the link for the Mental Health Youth Bill of Rights, and I would encourage people to look at that. It's mentalhealthyouthbillofrights.blogspot.com, and that's a great document that can be used with youth to help them take control of their treatment and their care.
Thanks a lot, Eliz. And I'm wondering if you'll just type that into the answer box and send that to everyone.
Sure.
We have a question from Karen Sims. Can you provide more information about the professional mentoring program? What is the name of the program? Do you use young adult mentors? And where can you find additional information about the model? Okay, and I think what you're talking about there, Karen, is Friends of the Children. That program has a website, which is a national website, and that is at www.friendsofthechildren.org, and I will type that in for you. The program actually has young people who serve as mentors to the children. When they're young, they see only 8 children in a full-time position, so they're usually with them 4 hours a week in intensive activities. And then later on, as they become young adults, there are many more group activities, and they work with the children and the youth in leadership activities. And this is a program that's had great success in altering the courses of the trajectories of the young people's lives. So I will type that in for everyone as well. Let's also go now to the question from Debbie Peters. The Facebook page, Bring Change to Mind, is also focusing on reducing stigma and providing support. And I guess that is a comment from Debbie. And we're about at the end. One more question. I'll take the last one. How is Friends of the Children funded? That's from Sharon Oden. And that is through contributions from individuals and corporations. It is a nonprofit organization that is largely funded through fundraising events and development. But in our particular city, there has been a levy that has been agreed to by the citizens to support children's programs. So it's called the Children Investment Fund, and they get a substantial portion of their funding from the Children Investment Fund of the city of Portland. So we will type in the website for the Youth Mental Health Bill of Rights, and we'll also provide the Friends of the Children and website, and I think that is going to be about it. So Eliz, are you going to close us out?
Sure. If you have any additional questions or feedback, please contact us at our emails. This is the Pathways RTC staff emails, and you can also check our project website right there. We will have a copy of this webinar posted on the Pathways RTC website. We also have a copy of our document, our competency document, on our project website, which you can reach there. And we just want to thank everyone so much for attending. Thank you to our panelists. And we just hope everyone has a great day, and we will talk to you soon. Thank you.